Okay, you ready?
Mm-hmm.
You were dispatched to a 23-year-old male with difficulty breathing.
BSI. Is my scene safe?
Your scene is safe.
Mechanism of injury or nature of illness. Nature of illness is difficulty breathing. Yes.
Mm-hmm.
Number of patients.
You have one.
Request additional resources. So an ALS ambulance.
They're on their way.
I will consider C-spine, but not do it unless prompted to later. GRC, what's my general impression?
Your general impression is your patient is tripoding. He's breathing rapid and shallow. He's diaphoretic and pale. And he's speaking in 1 to 2 word sentences.
Okay. Responsiveness of the patient. I'll check by introducing myself, ask him some A/No questions, and how is my patient responding?
He is alert. But like I said, he's speaking in 1 to 2 word sentences.
So responsiveness, he's alert.
Mm-hmm.
Chief complaint, difficulty breathing. Are there any other apparent life threats?
No.
Okay, ABC. Assess airway and breathing. Ensure adequate ventilation. And initiate oxygen therapy as needed. Airways open. His breathing is rapid and shallow. And I will put him on 15 liters of oxygen via non-rebreather mask.
Good.
Circulation. So we'll check his pulse, which is what?
Patient's pulse is 108 at this time.
And the quality?
Strong and regular.
Skin, you told me he was diaphoretic and pale, but what is the temperature?
He's warm.
Warm, pale, and diaphoretic.
Mm-hmm.
Assess and control any major bleeding. Is there any major bleeding?
No.
Okay. Determine patient priority level. Make him a high priority patient.
Okay.
OPQRST. So now we're going to ask patient questions. O is onset. What were you doing when you started having difficulty breathing?
I was running through the park, doing my daily run, and all of a sudden I felt a sharp pain on the back of my neck.
Okay. P, provocations. Anything make difficulty breathing better or worse?
It's better when I sit down.
Can you describe how it feels?
My breathing feels like I just can't get a deep breath in, and the pain on the back of my neck just feels like a sharp pain.
So does the pain in your neck radiate anywhere, or is it just in your neck?
No, it just stays right there on my neck.
Yes. Severity. On a scale of 1 to 10, how would you rate the pain on your neck, and the difficulty breathing, 10 being the worst?
The pain on my neck, it's okay. It's probably about a 4. But my breathing, it feels like it's getting harder and harder to breathe.
Okay. time, can you give me the time that all these complications started?
About 10 minutes ago, about when I called you.
Okay, so we're going to take the sample. Signs and symptoms are difficulty breathing, pain in the back of the neck, and also diaphoretic. I guess that'd be a symptom. Allergies. Do you have any allergies?
I'm allergic to bees.
Do you take any medications? Do you have any medications?
I always carry an EpiPen.
What was the last thing you ate or drank?
I had some sushi.
Is he allergic to bees or is he allergic to fish? Events leading up to present. So can you run through past pertinent medical history?
I'm sorry, I zoned out. I have none.
Okay, so you've never
had an
allergic
one
reaction?
time I was when I was 3, I stubbed my toe.
How do you know you're allergic to bees?
Oh, back to the bees. I was hospitalized for like a month one time, no big deal.
For what?
Because I got stung by a bee and yeah.
Events leading up to present. So can you run through all of what happened today for me?
Well, like I said, I was running through the park, doing my daily run. And then all of a sudden I felt a sharp pain on the back of my neck. And it has become difficult to breathe.
Okay. So I think it's secondary assessment. So for secondary, I'd probably assist before anything else. I'd probably assist the patient in administering his EpiPen. But secondary assessment would be checking his breathing, lung sounds. How are his lung sounds?
Because you're checking pulmonary? Is that what you're saying?
Yes.
Okay, all right. His lung sounds have some wheezes. You notice wheezes.
Okay. I'll be assessing his entire chest, assessing the back of his neck, making sure there's nothing else. Vital signs.
What vitals are you going to be checking?
Pulse, blood pressure, and respirations.
Okay, his pulse
is 108.
108. His blood pressure is 146/86.
Wait, hold on. What was it?
146/86. And his respirations are 20.
Okay. My field impression is that my patient is probably having an allergic reaction to bees. Sounds like he got stung by a bee in the back of the neck as he was running. Eye interventions. Interventions would be administering high flow oxygen, 15 liters per minute via non-rebreather mask, and helping administer the patient's own EpiPen. reassessment. High priority patient. Even though we stayed and played for a little bit, we're still going to transport him to a hospital. So reassessment will be every 5 minutes, rechecking all the vitals, so pulse, blood pressure, respirations, and then redoing my secondary assessments with the pulmonary and then back of his neck.
Okay.
And then my report would be, I have a 23-year-old male who was running through the park. Vitals are, he had 108 pulse, blood pressure is 146 over 86, respiration is 20, only allergy is bees. Patient had his own EpiPen from a past bee sting, so I help administer his EpiPen. We gave him high flow oxygen, 15 liters per minute via non-rebreather mask, and put him in a position of comfort.
And after you gave the EpiPen, his breathing became much easier. His color came back.
Patient seemed to recover well after administering oxygen and his EpiPen.
Good. Perfect. Good job.